ठीक है. अच्छा, Hamza 2 I think we should be starting on time, I think.
ओके जी सर, ठीक है, स्टैंड बाय करें सर, प्रोमो वीडियो से स्टार्ट करें,
स्टार्ट करें.
सब कुछ स्टैंड बाय कर लीजिए. वी आर गोइंग टू स्टार्ट विद प्रोमो वीडियो.
ओके सर.
सर विल कंक्लूड इन जैसे खत्म होती है सर, अब जैसी स्क्रीन पे नजर आएंगे आप बोलना शुरू कर देंगे.
ठीक है.
ओके जी, बिस्मिल्लाह. 3 2
Bismillahirrahmanirrahim. My name is Dr. Hamza Azarghari, working as interventional cardiologist and assistant professor of cardiology at Rawalpindi Institute of Cardiology. First of all, I would like to welcome you all for this second edition, second season of Pakistan Cardiac Super League in collaboration with Pakistan Cardiac Society along with Wilson's Pharmaceutical. We all know that the first season was quite a big success. This time we are coming with a bigger bang. Initially in the first season we had 12 teams, now we have 18 teams. So we are all hoping that the fight and the competition is going to be much tougher. I'm so excited myself, I've straight away jumped from my cath lab into this wonderful studio, as you can all see. So with this, I will take the opportunity to start by welcoming our Council of Chairpersons. First of all, our program chairperson, Professor Dr. Feroz Memon, who's chairman and scientific council on academic affairs, Pakistan Cardiac Society. He's also doing as vice chancellor, principal and professor of cardiology at the University of Modern Sciences, Tando Muhammad Khan, Hyderabad, Pakistan. I now welcome the patrons in chief, and starting with Professor Fawad Farooq. He's the General Secretary of Pakistan Cardiac Society, Professor of Cardiology, National Institute of Cardiovascular Diseases, Karachi, Pakistan. We also have with us Professor Dr. Syed Tahir Shah. He's the Vice President of Pakistan Cardiac Society. He's doing as Professor and Head of Cardiology Department, Kuwait Teaching Hospital, Peshawar. I now move on to the next set of dignitaries, without which these matches will never be a possibility, as they weren't in the previous season. I would like to welcome our umpires for the game today and for the next few games. And today we have Professor Dr. Muhammad Ishaq. Welcome, sir. He's the Professor of Cardiology, Karachi Institute of Heart Diseases, Karachi. We also have amidst us Dr. Abdul Hamid Siddiqui. As an umpire, he's Consultant Interventional Cardiology, Professor of Cardiology, ex-Professor of Cardiology at Armed Forces Institute of Cardiology, National Institute of Heart Diseases, Rawalpindi, Pakistan. And we also have Professor Javed Syal with us. So welcome to all the dignitaries. It's great to have you. But now I think we now move on towards the next phase, and that is for the match today. So today we are going to kickstart the first match, and this is going to be between N.I.C.V.D Kings versus P.I.M.S Leopards. So I hope the two teams are ready. So I would ask the two teams to come up with their introductions. So first I'm going to start with N.I.C.V.D Kings, if we can have them on the screen. Assalamu alaikum, best of luck for the game, and I will ask the captain to give the introductions, please.
Captain Dr. Kainat Naseem, and here is my team, Dr. Shahir, Dr. Sumaira, and Dr. Shidba. We are excited for this match. Thank you.
Well, best of luck. Now we have P.I.M.S Leopards, and the captain to please introduce the team.
My name is Dr. Subabu and here is my team, Dr. Aisha Tariq, Dr. Nabil, and Dr. Shahjahan.
Well, best of luck, Leopards. I hope it's going to be a tough game and you will fight it out. So with this, I think we will move to the format in which we'll have two teams. We'll have the toss first. We'll have 10 questions apiece. And then whosoever scores more is going to win. And with this, I now move to the toss. So can we have the toss, please? It's going to be an electronic toss of coin. So I'll ask one of the teams to call the toss. So I think it's the Leopards, P.I.M.S Leopards. Tails or heads? Please call it. So heads it is. Right. Can we have the coin toss? And yes, it's heads. So that means you won the toss. So are you going to take the questions or you want to throw the questions?
We want to throw the question.
So Leopards have decided to throw the question. P.I.M.S Leopards, they'll be throwing the questions first. Gigi, P.I.M.S Leopards, they've decided to ask the questions. All right, so are we ready? Both the teams.
Yes.
Kings,
Yes,
are
we are
you ready
ready
to take the questions? Yes.
Yes, we are ready.
Okay, so here we have the first question on your screen, and I will request the Leopards to read it out. Start, please.
Okay, a 65-year-old diabetic and hypertensive gentleman presenting to the ER with complaints of dyspnea and NIH class 3 for the last 2 hours. On examination, the patient was tachypneic with a respiratory rate of 32 per minute. His oxygen saturation was 90% at room air, while the heart rate was 110 per minute and the blood pressure was 94 by 64 mmHg. Test examination revealed bilateral crepitations up to mid-zone. Cardiac auscultation revealed a grade 2 by 6 systolic murmur at the left lower sternal edge. ECG revealed ST depression in V1 to V4 and poor RV progression. The patient was started on supplemental oxygen, aspirin, and IV furosemide. His past history was significant alcoholism, smoking, and prior to the current illness, he used to carry out his routine activities, including playing golf fortnightly with mild limitations. The patient previously could climb 2 flights of stairs with mild shortness of breath.
Okay, so we are done with the first question. So are the Kings ready to take the options?
Yes.
Okay, can we have
Yes,
the
we
options?
are ready.
All right, so you can read the MCQ's answers as well. Please read the answers quickly. Leopards.
The question is, what seems to the most likely cause of the patient's shortness of breath? Alpha, heart failure due to chronic alcoholism. B, heart failure due to ischemic heart disease. C, heart failure due to hypertensive heart disease. C, cor pulmonale, and the D is heart failure with preserved ejection fraction.
All right. So you've got 60 seconds and the timer starts now.
स्पेशल ट्रीटमेंट है, ठीक है। पेशेंट को भी मरमर आ रहा है, यानी कि या तो ईएस है या पेशेंट को
वो बस क्रॉस पूछ रहा है अभी कि हार्ट फेलियर किया किसने, तो वो स्कीम में लग रहा है VSR भी है तो स्कीम क्योंकि
Good. So we just have less than 30 seconds now. I would like to mention here that all these questions
yes
have been reviewed by
we
the
would like to
council.
answer
Okay. Sure.
Bravo.
Go ahead.
Bravo, heart failure due to ischemic heart disease.
So it's option B.
Yes.
Should we lock it? Oh yes. So yeah, we've done it, and I think we have started off with a 6. Well done. Great start. So that's a 6 to start off with. That's a wonderful start. That's what we all were looking for. Great job. So I think now we move on to question number 2.
Okay, which of the following pulse characteristics are likely to be observed during patient's examination?
Alternance.
Pulse is by pulses paradoxal, low volume steady pulse, pulses alternate, and pulses power cardiac.
All right, and your timer starts now. 60 seconds.
Alternance होता है
बायफरेंस नहीं देखो हुक्म मिलता है
I'm hoping for a 6.
पेशेंट की प्रेशर 90-60
90-60 वो हार्ट फेलियर में वैसे ही मिलेंगी we would like to answer D, delta pulses alternance.
Okay, option D. You want us to lock it?
Yes.
Okay, lock. Answer D, and yet again, 2 consecutive 6s. Well done. And I was actually hoping for it. I think, good job. Well done. With this, I move to the third question. Can we have it onto the screen, please?
Okay, the third question is what is the patient's loss classification?
Can you, I'll request you to speak a bit louder. Please keep the mic closer. Leopards.
Okay, the third question is what is the patient's class classification?
Okay, so it's the KLEP classification. Okay.
Yes. Alpha is 4, Bravo is 1, Charlie is 3, and Delta is 2, and Alpha E is the need more information.
All right, so your timer starts now. 60 seconds.
Can we please repeat the scenario?
You want to see the scenario? Can please
Yes.
take us back to the scenario quickly if we can have the screen.
3 का option.
Okay, you'll have it shortly on your screen.
No, we can't see.
Okay, you have it now.
देखो pressures ठीक है. Zone तक है. Yes. Move on to the options, please.
Back to the options on your screen.
Yes. 3 कर रहे हैं.
C.
And Charlie C3.
Sure? Should we lock it now?
Yes. Yes, please.
Option C. Oh, yes. So I think they're pretty sure, they're pretty methodical. Good job. Well done. So we have now question number 4 on your screen. Please read it.
The patient, okay, the question 4 is the patient underwent troponin measurement which came out to be 38 nanogram per liter. What is the interpretation of this measurement? Alpha undetectable, B low, C high, D borderline, and E is very high.
And your 60 seconds start now.
ये लीटर में
ठीक है ठीक है हाई नहीं है
नैनोग्राम पर लीटर है ठीक है यानी कि ये वैल्यू सही है अब हमारे इसकी नॉन रेंज जो होती है ना होती है फीमेल्स में 24 होती है मेल की कितनी होती है
55
नहीं मेल की 40
बरेमल नहीं होता वो बरेमल नहीं होता हाई नहीं है लो भी नहीं है
हाई नहीं
तो ये 0.0 में वैल्यूज नहीं होती
नहीं
ये नैनोग्राम
वो ml वाली होती है
ml वाली मुझे ये ना बॉर्डर लो भी नहीं लग रहा 0.04
30 seconds left.
C नहीं है E नहीं है ठीक है
अनडिटेक्टेड लो या
अनडिटेक्टेड हो सकेगी मेल पे
बॉर्डरलाइन नहीं बॉर्डरलाइन
15 seconds.
We would like borderline.
What?
Delta.
Delta.
Delta borderline.
Borderline delta. Lock it. Oh, that's great job. Really got close. I thought it was an in-swinger, but you played it well. Good job. So we have question number 5 on your screen.
Question number 5 is which troponin assay is the most strongly associated with non-cardiovascular death? Alpha, high sensitivity troponin I, beta, conventional troponin I, C, high sensitivity troponin T, D, conventional troponin T, and E is both B and C.
Okay, so your timer starts now. 60 seconds.
A और C हटा दो A और C
बी और
अब भी बचा तो यूजुअली जो बाहर टेस्ट करवाते हैं टॉप टी तो हमारा कन्वेंशनल टॉप टी होता है
तो इसके अंदर हम कहते हैं कि कार्डियक कॉज
नॉन कार्डियक तो मेरे ख्याल में तो
हाई सेंसिटिविटी टॉप टी जो है वो हमारे मसल से भी रिलीव होता है
मैं कन्वेंशनल टॉप टी है वजह ये हमारे नॉर्मल किट यूज करवाते हैं हमारा
बी कह रहे हैं
30 seconds.
हम लास्ट ऑप्शन
वो बी और डी दोनों है
मुझे बी और डी कर रहे हैं
मुझे भी
पीओडी करने
मुझे भी नहीं लग रहा POD.
मुझे डी के बाद
Conventional drop I नहीं करें.
दोनों
आई
मुझे बी और डी
मुझे तो टी
मैं टी मैं डी
Less than 10 seconds. Hurry up.
Delta conventional drop T.
It's option D. Conventional. Oh, that's the first one. So a good delivery. I think that one did beat you, but we did enjoy the discussion that you were having. But never mind. It's already a good score. So I think with this we move to the next one, and we have question number 6 on your screen now.
The question number 6 is a repeat high sensitivity troponin I is sent at 3 hours interval, which comes out to be 120 nanogram per liter, and the diagnosis of N.I.C.V.D is made. What is the patient in state? A, 4, B, 2, C, 6, and D is
ऐसा भी नहीं है चेस्ट में
2. These 2 or 1?
Okay, so your timer starts now.
रिस्क फैक्टर कौन दो फैक्टर पता कितना है
दो पॉजिटिव होने चाहिए तो डायबिटिक भी था स्मोकर भी था
एज 65 क्या भी दिखाएंगे
तीन थे. Hyperlipidemia बता. Scenario please.
सिनेरियो प्लीज
We would like to see the scenario please.
We would like to have the scenario on the screen. Okay.
डायबिटिक हाइपरटेंसिव दो
Age 55. Is it 65 or 55?
65
Please let us see the options.
30 seconds. Please show the
देख लिया
options.
ना? Alpha 4.
Okay. Are you sure?
Yes, we are.
Okay, ji. Lock. Oh. All right. So we've started having a few difficult ones, tricky deliveries. So that's the second miss. All right. Better luck next time.
सेक्टर थे ना सेक्टर थे
हाँ वो तो किए हैं.
All right. So let's move to the question number 7 on your screen. Please read question number 7.
वहाँ पे भी हल्का
आगे
मारा
कुछ लिखा हुआ है नजर नहीं
ये देखें ये डीप अभी इसको हाइड कर रहे हैं ओके
Okay.
We cannot read the option E.
Yes,
Same here.
Wait.
You can't read the option E, that is, in question number 7?
Yes.
So it's option E is EPSS.
राइट साइड जी
डिसाइड ये
साइड जी ठीक है
हम read
साइड से जी है कौन सा पैरामीटर हार्ट फेलियर को ज़्यादा बताए
Okay. So I think we'll start the timer now. Option E is EPSS. Can you see it now? Teams, leopards and kings. Can you see option E?
पल्मोनरी आर्टरी बताता है
मुझे डी
मैप से
लग
मैंने
डी
सुना
डी
है
लग
Timer starts, please. Now. So both the teams, listen to me. Can you see the options?
यस वी कैन
Okay. Thank you.
रेड ही नहीं किया ये एक्सक्लूड करने ई क्या ऑप्शन है ई ये ई क्या लिखा है EPSS बी का जो पड़ा बी डी
30 seconds. Come on, teams. You do a lot of echoes.
We would
Come
like
on.
to go with delta LVOT VTI.
Okay. So you want to take option D? Should we lock it?
Yes.
Are you sure? Okay.
Yes.
Well done. Well done. I was hoping for it, but I think a good response, good reply. Well done. So we are back on track. With this, we move on to question number 8. Please read it.
Question number 8 is which of the following medication have been shown to reduce decongestion in heart failure within the 3 days of initiation? Number A is dapagliflozin and B is acetazolamide, C is sacubitril valsartan, D is versigouet and the E option is I can't read it.
Is it not visible or you can't read it? It's some.
I can't see it.
Okay, so it's empagliflozin. You can hear me, right?
Yes,
Empagliflozin.
I can hear.
Okay. Start the timer, please.
3 days of initiation
डापा तो
सेम है लास्ट ई क्या है ई क्या है
E is empagliflozin.
EOD कट गए EOD कट गए एसिटाजोलामाइड पे ट्रायल हुआ है आप सेक्यूबिट्रिल चूज करें एसिटाजोलामाइड दोनों में से कोई
मुझे लग रहा है सेक्यूबिट्रिल लग रहा है
उसकी वजह ये है कि हमारे पास भी हमारा इनिशियल रिलीज के लिए
सेक्यूबिट्रिल we would like to go with option Charlie sacubitril valsartan.
Okay. You want me to lock it?
Yes.
Okay, lock option C. Oh. So, yeah, turns out it was a googly. Never mind, we still have a few balls left, a couple of balls. So, next question, question number 9.
Question number 9 is which of the following class of antidiabetic can potentially be harmful for the patient in the context of heart failure? Number A is sulfonylurea, second is C is SGLT2 inhibitor, D is DPP4 inhibitor, and 4 is
लास्ट में नजर नहीं आ रहा
E is GLP-1 agonist. E is GLP-1 agonists. Start the timer, please.
We would like to go with option Bravo thiazolidine diones.
Oh, that was quick. We are absolutely sure. Should we lock it?
Yes.
Okay. And great. That was a rapid fire. Good shot. Up for a 6. Well, came out of the crease and hit the ball out of the park. Well done. So with this, we move to the last question. Question number 10. We are hoping for a 6. Let's see.
Question number 10 is during hospital admission, the patient undergoes coronary angiogram followed by the complete revascularization, following which blood pressure improves. However, the patient still remains tachycardic. Which of the following medication is likely to confer a mortality benefit? A is digoxin, B is metoprolol succinate, C is metoprolol tartrate, and D is atenolol. And the option E is
Nebivolol. Nebivolol. And your timer starts now.
We would like to go with option Bravo metoprolol succinate.
Okay. Another one. quick fire. So you want me to lock it?
Yes.
Okay, lock option B. Yes, well done. Came outside, out of the crease, and here it goes out for a big 6. So well done. I think you're finishing on a high note, and the total score is 42 out of 60. Well done. I would say Kings have done pretty well. Let's see. It's gonna be a tough match. So I think P.I.M.S Leopards will really have to buckle up. And with this, I think we come to the end of the first half. And this is the scenario. This is the performance. So as you can see, they've scored 42, and they'll have to beat the score, the Leopards, on their turn. I would now request the council to give their comments, and I would request Dr. Javed Syal, Professor Javed Syal, if you could start off, and if we could have some comments from your end, sir. And he's also the immediate past president of Pakistan Cardiac Society, as we all know him. Sir, if you could have a few words from you. Or anyone from the panel, I would request Professor Dr. Feroz Mehman, if he's there. Okay, Professor Fawad Farooq Saab, I would like to have your comments, please.
Yeah, very smooth first inning. But I have noticed few things which need to be like, as most of the time, the team who's answering needing the scenario. So I think after giving options,
yes,
re-scenario should be given for at least 10-15 seconds while their timer is going on. Make it a habitual or a standard that a scenario should be presented on the screen to make them easier correlate the things which is asked in that particular. And second, when the timer is on, I think option and the scenario should be screened. Don't put the teams on full screen, because we are also trying to answer these. And the moment these options are out, then we are out, because so while the timer is going on, because we are seeing them in small screens. So this options, and for few seconds the main lead question should be there, so that that will help them correlating and giving right answer. But overall, this time the questions were a bit related to the scenario in a way, not clinical scenario, but as a recall, things are relating to heart failure and other. But overall, it was a very nice first inning. Let's see the second inning, what happens there.
All right. Thank you very much, sir. I think pretty pertinent points. I think, as we all know, it's the first match and sort of a pilot run. I think they'll figure out things. And I think the technical team is also making notes of these wonderful suggestions. And hopefully, I think we'll have separate screens to save time and make it convenient for the competitors and also for our worthy esteemed panel members, so that they can also get involved and make the most of it. So I would now request any of the worthy panel members.
Hamza,
Assalamu alaikum, sir.
Can you hear me?
Is here.
Assalamu alaikum. First of all, my greetings and regards to all of you for the second spell of this league. I think the match, as Fawad said, went very smooth, and we had a good result too. I have just one suggestion for the contenders, that you have 60 seconds. You may know the answer, but don't jump onto the answer in 10 seconds or 25 seconds or 15 seconds. Take your time, review it, because many times you may be wrong, and giving a little bit more time might bring a right answer on the surface. So there's no point rushing on the answer. You have 60 seconds. You may not consume the whole 60 seconds, but at least 40-45 seconds, even if you know the correct answer, you should take. So sometimes you may be wrong in your first impression. And secondly, I think Fawad's suggestion that the scenario should be shown simultaneously. It's not a bad idea if you got two screens, then that will make them refresh the actual scenario and they can correlate with it. Because the scenario can sometimes be so long that they forget what the actual scenario was, what were the contents of the scenario. And by the time you ask question number 6 or 7, they have already forgotten the contents of the scenario. So I think scenario should be accessible to the candidates during their answer. With
Right,
this,
sir.
I would like to thank you all for having me, and Feroz has something to say.
Thank you very much, sir. I think the technical team is making. So, Professor Feroz, please go
Congratulate.
ahead.
Thank you very much. Assalamu alaikum, everybody. I must congratulate Wilson team and thank you Fawad and Javed Syal for cooperating and collaborating this wonderful program. I think this is as interesting as any PSL or IPL match or whatever it is. अच्छा मेरी बस एक सजेशन थी कि जब मैं डिस्कस कर रहे थे तो लास्ट ईयर हमने SOPs बनाए थे तो उसमें हमने कहते कि जी स्टेटिस्टिक्स जो बहुत नियर बाय होते हैं न्यूमेरिकल्स वो हम नहीं डालेंगे. आई एम नॉट श्योर कि जो अभी हमने टॉप टी वाली वैल्यूज डाली थी was it a justified question or not, because labs में वैल्यू हो जाएगा थोड़ी बहुत डिफर करती है तो you might come up with wrong answer. तो I thought ये इस तरह की चीजों को थोड़ा सा हम SOP बना लें कि ये चीज हम नहीं रखेंगे if the panel agrees with me.
Yes, I think
Very
that
right,
question wasn't without reference as well. Just dropping in I value without mentioning exactly which kit and what are the reference limits for that particular. So I think even the teams can raise any query about any question or answer, and that will be subjected to Empire and Council later on. I think since it's the beginning, with passage of time, we'll try to overcome all these things.
Thank you very much, sir.
Yeah,
I
I agree.
think valid points.
And N.I.C.V.D very well because the जवाब इसका सही दे दिया. But I thought there's a reason to argue on this.
Yeah, exactly.
I think.
Can I just add one thing, that the question was somewhat straightforward and smooth. It was not a very difficult one.
Yeah.
Because I have reviewed it and I found it easy for me. So I think it is easy for the candidates also.
So you're also always thinking that it will going to be answered, so there's no point in really changing it.
Very right, sir. I think when we look into the technicalities, the point that has been highlighted in terms of reference values, I think it's pretty spot on. But then again, at times the questions are also extremely leading, as Professor Saab has mentioned. So I think all in all, we will improve as we go on, as we did in the last season. So any more comments? Because then I think otherwise we'll move to the next innings.
I think you can.
Right, sir. So are the teams ready? Okay. So now the P.I.M.S, Leopards, they have to take the questions. I hope the batters are ready, and N.I.C.V.D, they are ready with their questions. So we have the first scenario on your screen. So this is the scenario. Please read out the scenario. Kings?
Yes. A 65-year-old gentleman with premorbids of insulin-dependent diabetes, hypertension, and CKD with eGFR of 40 mm per meter square presents to cardiology OPD for evaluation of atypical chest pain of 2 years duration. The patient can climb 2 flights of stairs with minimal fatigue and his functional capacity has remained unchanged for last 3 years. His ECG shows left ventricular hypertrophy, 2D echo shows EF of 50%, concentric left ventricular hypertrophy, and TR with PAP of 30 mm of mercury plus CVP.
It's CVP.
CVP. A 65-year-old gentleman, again the same scenario repetition. A 65-year-old gentleman with premorbids of insulin-dependent diabetes, hypertension, and CKD with eGFR of 40 mm per minute per meter square.
We can't see the question.
Okay, so we have to see the questions. Okay, you'll have the questions and the vignette.
No.
I think question should be on the big screen. I
I
think this
can't
time
see
question
scenario.
should be on the big screen.
Can we have the question on the big screen, please?
Sorry, sir, I
No,
can't
these
see
are the
scenario.
options. First,
Okay,
I think the
relax,
main
relax.
scenario should be.
We will help you out. Don't worry. Yes. So can we have the scenario? You want to see the scenario?
Because it's not
It
completed
wasn't
yet.
complete, sir.
Okay, okay. We'll give you time. You can go through it. I will only start when you're ready.
Okay, we are done.
You're done? Should we start with the
Yes, sir.
first question?
Yes.
Okay, please, can we have the first question on the screen with the options? Please read the options along with the question.
Okay, the question number 1 is keeping in view of patient's functional status. What seems to be the likely meds of the patient can achieve? A 1 to 2, B 2 to 4, C 4 to 10, D more than 10, and I cannot read the option
Oh,
E.
E is need more
Need more
information.
information.
Okay, well done. So timer starts now, 60 seconds.
We will go with Charlie. C.
Are you sure?
Yes.
So some very wise words came from Professor Ishaq Saab, and he wanted you to give it more time. So, are you so sure that you want me to lock it straight away? 30 seconds.
C, sir, Charlie.
Okay, lock the option please. C, 4 to 10. Well done. Great start. Okay. So I think this may just go down to the wire. Let's see. Well done. So good start, just like the Kings. So can we have question number 2 on the screen? Please read the question along with the options.
Okay, the second question is patient serum creatinine is 2.2 milligram per deciliter. What is the last reading, while the last reading taken 6 months back was 1.7 milligram per deciliter. You decide to proceed with EGFR calculation using CKD EPI formula. Which of the following is not a variable of the said formula? A, age, B, gender, C, creatinine, D, race, E, both B and D.
Okay, so the timer starts now.
We will go with Delta.
Okay. I think it's truly a T20 going on, and they seem to be in a hurry. You want me to lock it? Okay, so which option should we lock?
D, sir, D, Delta.
D. Lock option D. Oh. So I think they are matching their counterparts, the Kings, ball by ball. Well done. So with this, we move to question number 3 on your screen.
Question number 3 is you plan to assess the patient's CIN risk using Mehran score. Which of the following variables is the most important variable of the SAID score system? A, diabetes, B, anemia, C, age more than 75 years, D, tachycardia, E,
Is
CHF
CHF class 3. E is CHF class 3. Timer starts now.
We will go with Alpha.
Okay.
Lock Alpha.
Alpha. Okay. Lock alpha then. Oh. So that's the first missed question. Oh. Again, I thought maybe you would give it some more time, but never mind. I think we still have a lot of questions to go. Right. Move to question number 4.
Okay, now the question number 4 is As per schema CKD trial, which of the following is true with regards to invasive strategy in comparison to a conservative strategy? A. Improved quality of life. B. Reduced critical events, clinical events. C. Both A and B. No. D. No significant effect on clinical events. I cannot read the option E.
Okay, option E is no significant effect on clinical events and quality of life. No significant effect on clinical effects and quality of life. Okay, the timer starts now.
Who will go with Charlie? C.
You have almost 30 seconds to go. Are you sure?
Yes.
Okay, then lock option C. Oh, that was an outswinger. You missed it by a whisker. I would say more than that. All right.
Hamza, do we have an option of super over?
I hope so. I hope so. I think it's going to make it very interesting indeed. So, but I
Hamza,
just
I
want.
will again, Dr. Hamza, I will again ask the contenders to please consume your time. You may have the right answer if you don't jump.
Yes, sir.
So please take notice of that. This is coming out of experience, and nothing beats experience, as Professor Ishaq is time and again reiterating that. So with this, we move to the next question, question number 5. Come on.
Now the question number 5 is, the patient continues to have chest pain, now at progressively shorter intervals of time despite escalation of medical therapy consistent with a clinical diagnosis of unstable angina. A decision is made to proceed with invasive angiogram. Which of the following interventions can reduce the risk of CIN in the patient? A. High intensity statins. B. N-acetylcysteine. C. Pre-procedure hemodialysis. D. Pre-procedure hemodialysis, post-procedure hemodialysis. E. IV soda backup peri-procedure.
And the
We
timer
will go
starts
with
now.
Alpha.
Timer starts now. Okay, so I heard something.
They, I think they are consuming now. They are
So,
consuming their
Captain of
time.
PIMS, I think you can keep the mic with you so that you can have your
Sir,
discussion going on.
Nikki.
Okay.
So we will go with Alpha, high intensity statin.
Okay, high intensity statins. So you want me to lock it now?
Yes, sir.
Okay, lock it. Yes, very well played. We are back on track, I believe. I think that super over could be in the making. Good. So the score is 18, and we move to question number 6. Almost 50% we are through. 5 more questions to go, and the next question is on your screen.
Question number 6 is, which of the following is an established risk factor for CIN? A. Heart failure. B. Hematuria. C. Proteinuria. D. Bedbound. And E. Metabolic alkalosis.
Timer starts now. That's a tricky one, I would say, but I am hoping for the best.
We would like to
30 seconds. Yes.
Alpha.
You want alpha?
Yes, sir.
Heart failure. You want me to lock it? A.
Yes,
Heart
sir.
failure. Okay, so lock A. Heart failure. Okay. Yes. It was really an interesting one, a tricky one, but never mind. I think it's getting tighter for you. You really have to buckle up now. Come on. 4 more questions to go. And question number 7 on your screen.
Okay, now the question number 7 is, which of the following lab parameters are consistent with CIN? A. Urine osmolality less than 350 osmol per kg. B. Rise in creatinine in less than 24 hours after contrast exposure. C. Low levels of cysteine C. D. Urine osmolality more than 380 or 350? 350 osmol per kg. E. Both A and C.
Okay, please start the timer. Come on, we are hoping for a super over. Come on. This is a crucial question. Be sensible. Twenty seconds. 10 seconds. Come on. Hurry up. 5. Which one? B? Option B, did you say?
Yes, sir, B.
Okay.
Bravo.
The timer already had stopped.
Yes,
No,
yes, I agree, because I think what we can see from here is it was almost, the timer was over.
I think I heard B. I
You
heard
heard
B.
me, sir? I think this is where the umpires will come into play. I'll request the umpires to give their feedback.
Yes, I think we should take them the chance.
Okay, okay. So as the umpire has suggested, we'll give them the chance. B, lock it, please. Oh, either ways, we were losing it. So, all right, I think now we know what the outcome is, but still I think we'll go up to, so we have the option of getting to the last question, maybe if or we can call it a day. I think we need to
Fawaz is already smiling.
I think you can ask the last question.
Yes, I think this exercise is for everyone to learn. So let's continue with the next few questions.
We should complete the test. We should complete the test.
Yes, okay. Right. Next question, please.
Question number 8 is, which of the following trials proposed an LVEDP based approach to pre-hydration for prevention of CIN? A. Pegasus. B. CKD EPI. C. Positron. D. Ischemia CKD. E. I cannot read the option E.
So option E is Persephone. So yes, it's Persephone, right? Timer starts now.
Bravo. B.
So it's a guessing game going on with all the trials and everything?
It should be B. Bravo.
So I should log option B?
Yes, B.
CKD EPI. Oh. So we missed this one. All right. Question number 9. This will definitely help you with the run rate also, so you should try to answer the question so that you can, even if you lose today, you may just still win. So fight for it. Come on. Next question. It's not over yet. Please read question number 9.
Okay, the question number 9 is, you decide to proceed with invasive angiogram after counseling the patient. The patient has an appointment for AV fistula in his right arm. Which vascular access site will you prefer for the angiogram, keeping in view the risk of CIN? A. Right radial. B. Right ulnar. C. Left radial. D. Right femoral. E. Left femoral.
And the timer starts now.
लेकिन एक ब्रेन को प्रोटेक्ट करेगा ना तो उससे
30 seconds.
क्वेश्चन कहाँ से हम ब्रेन को कम कर सकते हैं राइट से चला नहीं
Come on.
राइट क्वेश्चन ना लेफ्ट
10 seconds.
Right femoral.
Right femoral. Option D.
Yes.
Okay. Right femoral. Option D. Lock it. Oh, I was hoping for you guys to go with the right one. It's the left radial. Oh. Yes. So, never mind. So, I think we still have one more question to go. And that's the last question. I hope you'll hit this one out for a 6. Please read it.
Okay, now the question number 10 is coronary angiogram revealed 2-vessel coronary artery disease, which was followed by complete revascularization by means of PCI. A total of 200 milliliter contrast was used. LVEDP was calculated 14 millimeter of mercury. Based on posidone trial, what will be the rate of hydration to reduce the risk of CIN? LVEDP.
And the options?
Options are A 5 millimeter of per kg per hour, B 4 millimeter per kg per hour, C 3 milliliter kg per hour, D 2 milliliter kg per hour, E 1.5 milliliter per kg per hour.
And the timer starts now. Come on, leopards. You can do it.
E.
So you want us to lock A?
We would like to go with the elephant E.
Which one? Which option? Please be clear with the option. Which option should we lock?
E, sir, is elephant.
E for elephant. Okay, ji. E. Oh. Another one missed. So missed some consecutive deliveries in the end. I think the start was pretty promising. But with this, we come to the end of the second innings and we have a clear winner by quite a margin, I would say. And the winners are N.I.C.V.D. Kings. So well done to N.I.C.V.D. Kings and my commiserations to P.I.M.S. Leopards. But I think they can always come back stronger. So best of luck to them for the next few games. In fact, the whole tournament that they have. And well done, N.I.C.V.D. Kings. So I will request Professor Dr. Ishaq to give his comments. Sir.
Thank you, Hamza. First of all, nice to hear you after a long pause. Your beautiful voice and your style of moderation, par excellent. I think both the teams fought very well, but I have some comments for the Leopards. एक तो थोड़ी तैयारी मुझे लगा उनके कम थी, दूसरा आपस में कोऑर्डिनेशन भी जरा कम थी. Within the group, I didn't see much discussion and cooperation, and they were jumping on the answers rather too quickly. So I think this is a teamwork, and one person cannot answer all the questions. It has to be a discussion between them. And so I think more or less it was one-sided test. But as you said, they should not be disheartened. They should have more effort in future and improve their academics. One suggestion in the same context, Dr. Fawad Farooq and I also mentioned already. I think the copy of the scenario should be given to the teams. They should have a copy or a printout of the scenario sitting in front of them whenever they are answering the questions. Other than that, I don't have any further comments. Best of luck
Right,
to
sir.
all of candidates who coming in future. And thanks to Professor Feroz, Professor Syal, Fawad Farooq, and all those who are making it a successful match and successful effort. I have enjoyed the last season, almost all the matches. I hope this time, inshallah, I'll be also having the same benefit. And I think what we can see, the first series of league has really made a difference, because now we can see the candidates have become a bit more uh, trained, bit more learned in answering the questions. So I think it's a great effort by Wilson, for which I must congratulate Bilal and his team and all of them for putting up these shows. So thank you very much, Hamza, and I would like to hear Professor Feroz and others on this subject. Thank you.
Sure, sir. Thank you very much for your kind words. I think you give energy to all of us. And with this, I will also now request Dr. Abdul Hamid Siddiqui to give his comments, and we'll move through the whole panel gradually one by one. Sir, are you there? So I think if Dr. Abdul Hamid Siddiqui may not be there with us, so I will request Professor Feroz Mehman, sir, to give your comments.
Thank you very much, sir. I think I totally agree with the Sak's suggestion. He's always a leader and he gives very specific suggestions and very positive ones. Congratulations to N.I.C.V.D and P.I.M.S. Of course, I will ask them, encourage them that there's always another time, and I'm sure they'll get back into the game. Fawad's comments were very valid, and just now I saw N.I.C.V.D's comment that if you give the scenario beforehand, then people will know the case. But I think the Fawad's suggestion was that scenario should be given at the start of the game, so they should have it in hand while answering all other questions, so they do not have to revise and re-see or review the scenario back and forth. Thank you very much, Wilson. Thank you very much, our panelists and our Pakistan Cardiac Society, and especially Kaveh Syal Sahab and Fawad Farooq for supporting us to run this program. Thanks a lot.
Thank you very much, sir, for your kind comments. I think it's the effort which is done by the whole team, Pakistan Cardiac Society, in collaboration with Wilson. And I think it's the whole team that works together. We definitely hope to improve gradually, and I think they are making notes of all the suggestions. It's always good to have the vignette and the scenario in your hand. I think the teams can be provided with that.
Hamza, can I have a last suggestion
Sure,
for
sir,
the
please.
organizers,
Sir,
Bilal
please.
and company? I think this is a great academic exercise, and they should compile all these questions. जो पहले लीग हो चुकी है उसके भी सारे क्वेश्चंस को कंपाइल करें इन ए बुकलेट फॉर्म, और ये जो भी हो रहा है इसको भी एक बुकलेट फॉर्म में, एंड देन विद सम introduction and preface, we would like to publish them, because these are really excellent work that has been done. A lot of effort has gone into this. So I think Professor Feroz will agree with me that as a league we should print, we should compile these questions, और उनका एक final review हम करके इसको we should make it a small booklet. What do you think, Professor Feroz?
Sir, I totally agree, and this will be a lot help to our PGs for further examination, preparation, everything, and this will be a great job. I think this will be a great service, sir.
Greatly.
Fawad, I think, wants to add something.
I think Dr. Fawad, please, you wanted to say something.
Yes, I will just 2-3 things. One for the teams. Just a शेर मुझे याद आ रहा था, शिकस्तो फतह मियाँ इत्तफाक है लेकिन मुकाबला तो दिले नातवा ने खूब किया. So yeah. I think they don't have to be disheartened. P.I.M.S played very well. Unfortunately, I personally believe in their questions were a bit difficult. but it's a part of the game. It's all related to renal and cardio-renal issues, while N.I.C.V.D has to face pure cardiology. So they were a bit unlucky, so they don't have to be disheartened. They can prepare themselves much better. As Dr. Ishaq mentioned, there was a bit lack of teamwork. And sir कह रहे थे कि फवाद मुस्कुरा रहे, तो I have physical students as well as these PIMS people are my virtual students. So they all are similar to me. That's for the teams. And I'm really thankful to all seniors, especially Professor Firoz Mehman, Professor Ishaq, the kind of interest they are taking. They're always there. We sometimes miss these matches, but they are always there to really encourage us. And it's a very wonderful activity. And I personally agree with Dr. Ishaq's suggestion to making an archive, and not only just booklet, even you can a video archive. Don't take that 60-second altogether, just question, answer, question, answer, question, answer. And this now the options are showing right answer as well as wrong answer. So you can conclude this whole exercise in just 3 to 5 minutes, all 10 question and answer, and that will also serve for their revision and subsequent exam purposes or even practical purposes. So that's a very valid suggestion to make both print as well as video archive of these question answers. That's all from myself. Over to Hamza.
Thank you very much, sir. I think extremely well thought out. The archive is going to work. I think very soon, the way we are going, everyone will be after us to lend them the questions. I hope so. And I think we have two very important members with us. We have Dr. Professor Jalal Achakzai. I hope he's there. Sir, are you there with us? Professor Jalal. Okay.
Hamza, ये हर एक आदमी का स्टेमिना नहीं है.
Hamza, assalamu alaikum everyone. Professor Ishaq, assalamu alaikum.
Assalamu alaikum, sir. Good to have you.
So good to see that actually our team Bolanian is participating this time.
Great.
So I told the guys that watch this contest, and for them I'm watching all those. But I was not invited for this, so I just told them watch this contest, prepare, cook up well, and your competition probably would be on 6th of June. So it was really nice. The second edition, as was explained by Professor Ishaq, good to see the guys preparing well, and it's a good boost for all the students, for all the new upcoming cardiologists to prepare for the exam. I think this is a source which can really help prepare for their exams. And it was really a nice competition. N.I.C.V.D. Fawad, although is from N.I.C.V.D. and internally, I believe we would be very happy, and P.I.M.S, my sympathy with the P.I.M.S, because right now I'm sitting here in Islamabad. In fact, I can see the P.I.M.S from where I am right now. So it was really good. Thank you very much for taking me online, although I was not supposed to be a part of the panelist. Thank you, Dr. Hamza. Thank you very much.
Thank you very much, sir. It's always a pleasure having you. There's a lot of gloom at the moment in Islamabad, although it's been raining as well, a bit forecast, as you know. We have lost, yes, but I think kudos to Karachi for putting up the effort. We also now have Professor Abdul Hamid Siddiqui. I would request him to give his comments. So I don't think he's there. So I think that pretty much sums up the day for us. So well done to both the teams. I think participation is the key, and at the end of the day, it's the effort which matters. And it was an honor for me to be here amidst our stalwarts once again. And hopefully, inshallah, I will see you in the next game very soon. So it's Allah Hafiz. Till then, Khud Hafiz.